Riley. I'll be your nurse today. I'm going to go wash my hands real quick, okay? All right, I washed my hands. I provided privacy. I'm going to ask for 2 identifiers. Can you give me your full name and date of birth, please?
Wendy Marie Broik, 8/27/94.
Perfect. All right, so today we're going to do a skin, nail, peripheral vascular, and musculoskeletal assessment. So first thing we're going to start off with is looking at your skin. Is it okay if I touch you?
Mm-hmm.
All right, cool. So we're going to look at her skin, look for any lesions, any edema, kind of feel for the same thing, any ulcers or pressure issues. Yeah, everything looks good. Looking for color as well. When you're touching her skin, you want to make sure you feel for moisture, her skin temperature, any pain when I touch your legs or anything. Okay, so you also want to make sure you touch her toes, make sure she's getting enough blood flow down there. If her legs are cold, it could be an arterial issue. If they're warm, it could be a venous issue. Also goes with pain, also a huge indicator as well. Or if she gets tightness in her legs from standing too long, or if she just has pain overall when she's walking. So you want to really make sure to assess that. I'm going to look at your back too. It's really important to look at all skin areas when you're doing a skin assessment because there could always be something hidden, and especially in the groin area. I'm not going to do that right now, but you want to make sure you assess the groin, the rectum, every part of the body, every part of the skin. Also, you want to assess the skin trigger. So can I see your hand, please? You want to squeeze up. It should return right back down. If they're older, they could have tenting. It really just depends. Also, they could have sagging or excessive loose skin from like weight loss. So those are all things to keep in mind. Also, when you're looking at the skin mobility, older people usually have more loose skin. So when it moves one way, it could just stay. But since she's young, her skin should just move right back to where it's supposed to be. All right. And then we're going to look at her nails. So first we're going to do the cap refill. So you're going to press down. It should return to normal color within less than 3 seconds, and it did, so it looks good. When you're looking at her nails, you want to look at the thickness. If they're thick, it could indicate like an arterial issue. If there's splicing in the nail, it could indicate trauma or bleeding under the nail. So it's very important to look at all of that. You also kind of want to feel her extremities too for their warmth. A little cold, but nothing too alarming. She also said that's normal for her, so that's good. You also want to assess for clubbing, which is basically swelling of the fingertips, which causes the nails to like concave, kind of like balloon up a little bit, which is just a sign of hypoxia. Same thing with the fingernails. If they turn purple, also a sign of hypoxia. So it's really important to assess all the fingernails. And the same thing with the toes. So you also want to assess the toes as well. Assess their cap refill. She has toenail polish on, so I'm not gonna like make her take that off, but if I was in the hospital, I would make sure I ask her to take the nail polish off in order to see all of that as well. So same thing, looking at the shape of the nail, looking at her cap refill, the thickness, all of that. If it's yellow, it could indicate a fungal issue, so definitely something to assess and watch for as well. So peripheral vascular, you want to assess the upper and lower extremities for swelling, arrhythmia, basically if she's pale, blue, everything. So I'm looking at all of her extremities again. Everything looks great. You also want to assess her cap refill again for peripheral vascular. So again, press down on the nails, press down on the toenails. Make sure to assess that. You also want to assess her pulses, making sure she's getting enough blood flow to all of her extremities. So start with radial, go to brachial. Great, her jugular veins. Her femoral inside the groin, not gonna get all intimate. Popliteal, hard to assess this one. If you do indicate like a vascular issue, you really want to get a Doppler and make sure that this is up to par. Also get the inside of the ankles. Great, top of the feet. Great. I would also ask her if she has any like pain when I touch her legs. Any pain? No. Also when she like lifts, if she gets pain, so can you like lift one leg at a time? So if she had any like changes in color or pain when lifting the leg, also could be a sign of peripheral vascular issue. It's okay, you can let down. Okay. You also want to look at the heels. So people with peripheral vascular issues they could lose their sensation in their feet. So it's really important to assess the entire foot when doing a peripheral vascular check and a skin check. So you should also be looking at that during skin checks, and those questions should be asked. So when you're looking, you should look at the back of the heel, because a lot of people sit with their feet just chilling and they're not raised or anything. So you really want to make sure you just assess the heel in between the toes. Looks good. Everywhere on the foot. That's where a lot of the hidden issues are. So make sure you do that. Thank you. You also want to auscultate for roots. Also could be a sign that there is an issue. So I'm going to auscultate for roots in her carotid and her popliteal. I'm going to kind of listen for it. So let's do it. This might be kind of cold, but you put the belt on it. You don't put the big part on it, because that's not going to help you. So you need to put the belt part on the neck. I don't hear anything, so that's good. Can also do the legs. I can hear your pulse. All right, so bruise could just be a sign that there's an arterial issue. There's not getting enough blood flow. There's something wrong with the vein and artery, so you really want to assess that if you do think there's an issue present. Okay. The next is the musculoskeletal. So for musculoskeletal, you really just want to make sure you assess their posture first. So see if they have really bad slouching, see if they have like a little deviation in their spine, maybe they have a concave in their spine. So scoliosis is the deviation in the spine. I think he's just sitting there. Sorry, my cat is crazy. No, he's just chilling. Okay, if they have a little concave in the lumbar spine, that could be lordosis, seen in pregnant people, but also could be a problem in about anybody with a lumbar spinal issue. You also want to look for like kyphosis, seen a lot in older people, but also could also be an issue in anybody. So that is when the shoulders and the upper back is more at an angle. So you really want to make sure you assess that as well. You would assess her gait. I'm not gonna make it get up. But basically, I would have her walk away from me. So it's act like just walk away from her. Good. And then she'll just walk back. So you really want to make sure that she has a steady walk, that she doesn't have any unsteadiness, any irregular movements, any limited range of motion. So all could be an indication of weakness from like stroke or Parkinson's disease. So it's really important. Have you felt any weakness when walking at all? Okay. Also important to ask those type of questions. Any like pain in your posture when you're sitting, standing. So also very important to ask those as well. So then you kind of want to assess her bone integrity. So you're looking for any short or longer extremities, which I think they look fine. Will you hold them out for me real quick? Perfect. Or like hold your arms out for me.
I feel like one is longer than the other,
A little bit, but not like crazy. Basically, you want to make sure that they're even. It could indicate like bone breakdown, tendon breakdown, any joint damage in the knees or ankles or any part of your leg. So basically, you just want to make sure that everything looks good. So joint function, you're going to start from head to toe. So you're going to start with the neck, you're going to have them move it from side to side. Any pain? And then you're going to have to do chin to shoulder. Perfect. And then you're going to have to move your shoulders up and down. Any pain there?
No.
Perfect. And then you're going to have you raise your arms up. And then move them to the side. Do it again. Any pain? Good. And you can also have them do this against resistance. So have your arms out for me. And then press down. Good. And then flip your hands over. Press up. Awesome. That also assesses musculoskeletal function as well. There's also like bicep ones too, but I honestly don't really know how to do those yet. So that's to come. Same thing with shoulders. So like accessory muscles and nerves. You hold down and then press your shoulders up. Perfect. All right. Same thing with the legs. So you kind of have them stand up for this. And then you move your leg up and to the side, but you really can't right now. To the side, same leg, to the side. You'd also, like when they're in bed, if they have limited range of motion, you would help them do all of this, but she's very good at doing herself. So you can sit down. And then same thing with the legs. You can put them up. Perfect. And then, perfect. You can do that. And then I'm going to put resistance against her calf, so she's going to press back. Perfect. Press up. Great. Her feet. I'm going to move this so you can see what I'm doing. So with her feet, I'm going to have her put my foot underneath her foot and have her press like a pedal. Perfect. I'm going to put it on top and press up. Perfect. So you do that with both feet as well. Testing all that function. And that's also like goes with her strength. So I'll also put my fingers between your hands and squeeze. Awesome. Perfect. So that is the full assessment. Thank you, Wendy.
Thank you so much.
If there's anything that I forgot, please add it. Thank you.